Welcome to Blockchain 2025. We explore how blockchain technology will affect major industries in the future.
Each episode dissects one industry, how it currently works, why blockchain can disrupt it, and some blockchain projects trying to be the solution.
Blockchain 2025 is part of the Bitcoin.com podcast network. Learn about Bitcoin, create a wallet, and buy your first Satoshis all at Bitcoin.com.
Welcome to the second episode of Season 2 of Blockchain 2025. This is your co-host, Matt Aaron. Stuart is not with us today because he's working on the Claros ICO. Also, we are covering a subject that is incredibly complex, the most complex subject that we've dealt with in terms of current industry, and that's healthcare. So we brought in an expert and someone that's worked in healthcare for a while and is launching a blockchain network called the Open Health Exchange. Before we start, I think it's worth mentioning a couple things. I mentioned complexity. So the idea of this episode is to paint the picture of the healthcare industry and understand certain points right now where the system could be improved by improved efficiency, and it comes down to lowering costs, right? Listen, I'm not an expert, but I've read a bit. I've talked to people in the public policy department at Johns Hopkins, and even talking to Jeffrey Tucker, the economist. To me, there are huge problems in healthcare. It's not something that can be reformed. The whole system needs to be redone. Like, drastic changes need to be made. I personally believe in a peer-to-peer version of healthcare. And there's this whole idea that with the current system, and maybe it's true with the current system, that you have to have health insurance. But could there be a new system with less regulation, with peer-to-peer healthcare, lower costs, powered by free markets and private industry, where maybe it makes sense to have health insurance, but maybe not. Maybe young and healthy people, by taking care of themselves, could just pay for things out of pocket and manage their own risk that way. But with the incredibly high cost, and as we've seen this, there was a study in 2010 with ProPublica, and they compared the US to 6 other countries: Australia, Canada, Germany, Holland, New Zealand, and the UK. And despite being the most expensive healthcare system out of the 7, by far, they also performed last in terms of quality, efficiency, access to healthcare, and ability to lead long, healthy, productive lives. We could go on and on with examples here, which we'll get into the show. So we needed an expert, and that's why I brought in Ryan. Enjoy the show. Joining me today is Ryan Kuriakose. Ryan, how are you, man?
Good. Happy to be here today.
Well, Ryan, as you know, today's topic is healthcare. And I think there's kind of a stigma just saying the word healthcare, because there's a lot of stories that for you, myself, and listeners that hit close to home.
Yeah, no, I agree. I think healthcare is a big topic. I think no matter where you look, there's always a discussion about healthcare. And obviously there's the healthcare industry, but obviously when you talk about hitting home, it's actually, very personal, whether it's a yourself, family member, child, loved one, it's something you're always experiencing.
Yeah.
And it's something you never want to even worry about, to be honest, or think about, but you unfortunately have to at certain points. So
for sure. And from a 20,000 foot view and looking at all the complications and the horror stories, which we'll get into, I saw some on NPR the other day where a lady for a simple surgery had this bill for $170,000. They inserted some screws into her hand, and she was dismayed when she got the itemized bill to find out that for like the 3 screws, just the itemized cost was like $17,000, right? And I'm sure we could go on and on about how expensive things are and all the horror stories and all the corruption with pharmaceutical companies and health insurance companies. But to be honest, I've almost resigned. To me, it just seems like it's just big, obtuse, corrupt, slow system. And it's almost like I don't feel there's any hope.
Yeah, I think that is one way to look at it for sure. But one of the key things that, I think we always had to do, we sort of double down, right? In terms of how do we improve the system. So it's not good, even where it is today is not necessarily the best place it can be today, but obviously it's changed and shifted a lot over the last 20 years in terms of what type of treatments are available to us as end users or patients. So I think that is definitely, there's a lot of new treatments out there, a lot of new diagnostics in the market.
Sure.
There's a lot of advances that are happening, but I think on the other side is that as certain advances are coming into market, other parts of the system haven't been fixed or adjusted. And not only that, the healthcare system is really about ensuring that there's patient safety as well as positive patient outcomes. So you want to make sure you can balance that as well. We're sort of living in a world where people don't want to necessarily harm a patient, so they stick to an old way that they've been very comfortable with. In terms of 20 years ago, this is how healthcare was designed, and early computer architecture, et cetera, was designed to fit into, we're sort of retrofitting what we want today into this older architecture. So that leads to a lot of issues in terms of where cost is also a problem.
There's no doubt about it that we've advanced in terms of the types of care, surgeries, and things that can be offered, and the amount of lives that can be saved. Of course, there's antibiotic resistance, infections from surgery, things like that, which have always happened, right? And they're probably better today than they've ever been before. But I guess I want to separate saying that, the first thing I think about is just this fear of cost. Like, I feel pretty good at a U.S. hospital if something happens that they'll be able to take care of me. But what always, I think, the Elon Musk and billionaires out there are like, but will I be able to afford it? Because the biggest nightmare is that I get in some type of accident. I'm in the hospital for a couple of weeks. I can't work. And then I get out and the bill's $300,000 and I can't pay it. So I guess it's really towards cost. And you nailed it on the head there. But it's such a complex topic. And listeners, Ryan runs the Open Health Exchange, which we'll get into at the end of the show. And Ryan, before that, I believe you have additional experience in the healthcare field. Is that correct?
Yeah, so I'm actually a pharmacist by training, but I've primarily been working on the commercial side. So obviously as a pharmacist itself is very powerful because you're understanding how the healthcare ecosystem is working, how patients are impacted. But I took that into the commercial side. I've been working in the pharmaceutical sector. So I was actually involved in the launch of 2 commercial drugs. So I actually saw what it takes to go from clinical development all the way to commercial launch for specific pharmaceutical medications.
And how long does that take from development to launch?
It could be anywhere from like 10 plus years, to get something to market. But to our conversation even earlier, it really is about making sure that you are ensuring patient safety as well as effectiveness of medication. And that's what this whole process is. And we'll get into where some of those costs occur as well. And then, pharmaceuticals is great, but for me, it was really more about how do you move faster and how do you affect the whole overall system. So I moved out from New York to California, worked at a health tech company, was leading the analytics division there where we're selling right to hospitals. And then also as the CEO and founder of PillTalk, which is a mobile application for patient education for medications as well. And then right now I'm here as a COO at Open Health Exchange, looking really to create a digital healthcare marketplace to advance medical innovation.
Okay, so there's no doubt you have tons of experience in this sector and you saw it firsthand starting as a pharmacist. Okay, so here's a question. These are the tough questions. Like, we actually delayed doing this episode of healthcare, knowing that the industry is important, but it's like, man, This is complicated. But I'm happy to have you as an expert on the show. So Ryan, give us a 20,000 foot view of the current state of the US healthcare system.
When you look at the US itself, obviously healthcare is very global and it is even becoming more and more global over time. Healthcare in the US, it's not functioning the way that it should. If you turn on the news, you're always hearing about folks talking about healthcare with healthcare reformation and changes that are going from cost perspective. The main thing you have to understand is who are all the key players in this ecosystem. Those are all the people who are affecting the cost. So obviously there's the government itself who is funding on the public side. So if you have Medicare or Medicaid or any of those public services, you would actually be getting paid by the government. There are also private companies paying for healthcare, insurance companies, which you're very familiar with. So these could be, anything offered by an employer or Aetna or Humana, any of those other insurance companies that people are familiar with. You might get it from your employer. And then there's a lot of people who actually don't have any insurance because they either are below the threshold from employer-covered healthcare insurance, and there are also folks who just are not working who might be in a gap where they are not covered for healthcare. So when you talk about healthcare costs, if you have insurance, typically those costs are going to be covered by your provider, your insurance provider. But when you're not covered by insurance or you're underinsured, that's when there are a lot of these concerns from a patient perspective in terms of what does that cost mean.
Okay. So we mentioned like the government, the public insurance and then in the private insurance sector.
Yeah.
Searching Google, around like 10 to 11% of adults are without health insurance coverage, right? But then you said underinsured. And I feel like a lot of us are in that category because healthcare is quite complicated and there's so many different things that can happen to us. And by underinsured, meaning you're covered for maybe some of the basic things, but maybe not the catastrophes, or there can be loopholes and things like that. Talk a little bit about underinsured.
Yeah, so I mentioned some of the key players that are out there. Obviously, another big key player is also the patient themselves, so the person who actually needs these benefits. Everyone is trying to put pressure on somebody else within the ecosystem. So insurers are trying to put pressure on a provider. So that provider could be your doctor, it could be a small clinic, it could be a large hospital system.
Right.
If you think about in the Bay Area, like Stanford Healthcare or New York, a Northwell Health System. So these providers and payers or the insurance companies are in a constant negotiation in terms of who's going to pay for what.
Sure.
Insurance companies have generally put out that they will pay for part of this because they know that treatment can be cheaper for patients. So they are trying to bundle in a lot of these payments. So when they bundle in these payments, health systems are also pushed to streamline some of their internal processes at the hospital or their clinic.
I got to interrupt you there, man. It's just bundling payments and streamlining processes. Give me a tangible example of that.
Yeah, so let's just say, for example, you have a chronic kidney disease, right?
Okay.
So you have kidney disease, kidneys are failing, but there are things that providers can't do to treat that patient. Let's just say you are not taking care of the core problem itself. That cost is going to be exorbitant and keep skyrocketing, right? So in a case where the insurance companies don't put their foot down, they actually are going to keep paying for that service. So they said, you know what? This patient has chronic kidney disease and there are a certain amount of things that need to happen for this patient to be managed. So we'll give you $10,000, for example, from our side for you to manage that patient. Now the hospital's like, okay, you know what? We can do this probably for $6,000. We can do this for maybe $8,000 or even $9,000. Sometimes it actually would be more, but they are going to lose money at that point, right? So it is a matter of when they're getting a bundle payment of like a $10,000 for a specific patient, they're trying to figure out how do we manage this patient. So that is on the provider and
Gotcha.
The healthcare provider, like a doctor, hospital, and the insurance side. The other side, what you're asking about was how do we as patients actually end up paying for and being underinsured, right?
Right.
So there's a big push for patients to also take ownership of their own healthcare costs. And what people are looking for is, they will publish online costs for specific treatments or procedures. It's not easy to find, but if you're in that 10% of the population who actually is not insured or you're in the population that is underinsured, you want to make sure you can, it's like consumerism. You want to buy something on eBay or Amazon, you're going to go shopping for what you want to buy. So the concept is, we're going to pay a part of it. You need to find the best healthcare provider for yourselves so that you can pay the lowest cost for insurance.
Okay.
Some of these the government also is incentivizing this even with like high deductible healthcare plans where you are saying, I actually want to pay a low premium every month with my employer, but I will take a high deductible. So I'm assuming if I'm healthier and I don't need to see the doctor a lot, I might take that option. So insurance companies are trying to make healthcare more driven by consumerism. So consumers can actually pick and choose what they want.
Gotcha. Okay. So Ryan, to summarize this whole system, you have like the insurance companies and then you have the providers, the hospitals and the doctors, and they're always negotiating. And the insurance is looking at all these like statistics and big data saying you have X patient with a kidney problem, but you're not treating the core problem. It's costing us money. So we need to negotiate. Like you need to find a way to treat this core problem and they go like on a case by case basis. Now, let me ask you a question. Why are so many services in the US comparatively, at least I think, so incredibly expensive? Like a lot of simple procedures. I'm not talking about like life or death heart surgery, but just simple procedures. Why do they end up being so expensive now?
It's extremely expensive. And actually, you might have heard this, but the US has the highest expenditure per person living in the US. So it's about $10,000 cost for every individual in the US. But if you look at other countries, it's much lower in terms of managing patients' health. It could be anywhere from like $1,000 or $2,000 to manage one person's health.
So it's like 5 to 10 times higher than a lot of countries.
Exactly. And it's only growing, right? So the total is about $3.3 trillion in the US itself. But if you think about it, each person costs $10,000 overall in GDP.
So it's incredibly expensive. And okay, I'm going to take a guess. I would think that the hospitals and doctors, when they get part of these networks, have a lot of power.
Yep.
And there may not be a lot of leveraging power in terms of the consumer side to lower cost.
So there is a constant negotiation there in terms of that who's negotiating for how much reimbursement is happening. But where some of the cost is also coming from is the provider side. So on the manufacturer side. So for drugs itself, the cost for medication, for example, to come into the market, it's about $2.5 billion for one drug to come into market, right? So all these costs for medical services, medical innovation, it's actually lagging they're just throwing more and more money in to fix the problems. And all of these costs are actually being passed on to the end user. So when a drug is priced, the cost of a drug itself includes like an R&D cost, marketing costs, all this other stuff. So when you talk about pills, there's like obviously the recent news where old drugs today were being Martin Shkreli, right?
Right.
With that situation itself, they were overpricing drugs that you couldn't even think that you would want to overprice.
Like which type of drugs were they overpricing?
The cost to bring a single drug to market is about $2.5 billion. So these pharmaceutical companies, they're spending more and more on research and development, but they're getting less and less drugs approved through the FDA. So there's a imbalance in terms of spending and what your return on investment is for these companies. So ultimately that extra cost is being passed down to the insurance companies who have to pay for these drugs, who may or may not pay for a drug, or will negotiate with the healthcare providers to not cover or to cover those medications.
Have these groups, you have like the insurance companies, you have the manufacturers of like the drugs, and you have like the hospitals and providers.
Yep.
Who's making the most money here?
On the manufacturing side, there's obviously a big markup, right? Healthcare providers themselves are not necessarily making a lot of money. They're, even though they're charging a lot of money itself for procedures, they're trying to absorb some of this cost, and the margins are pretty low for a hospital itself. It's not necessarily a business you go to make money. To own a hospital or healthcare system is not necessarily the business you go to if you want to make money, but it is obviously a part of the ecosystem, and for many, it's somewhat of a calling. And those are all needed parts of the society today.
So is it safe to say that big pharma and the manufacturing is maybe the driving force, or the number one driving force behind such incredibly high costs that we pay?
Those are some of them. Obviously, they are also people within the health in that chain itself where those costs are being mismanaged. So there's a lot of people in between as well that are driving up costs as well.
Okay, so like middlemen, which we can get to, right?
So obviously there is services that these guys will be using. So from like a research perspective, they might need to be bringing patients on board, getting patient-specific data from on clinical trials. There's costs there. There's costs for regulatory costs. There's actually regulatory costs that are there to bring medications to the market as well. There is cost on supply chain. There's cost for competitive intelligence that people are paying for in the industry as well.
Sorry to interrupt. Competitive intelligence, it's like you and I have a drug company, we're making a drug, and we want to know what the other drug company is developing and doing?
Exactly. So they would want to know, like, how are you positioning against different companies? You need to make sure your marketing and sales, there's obviously different incentive structures that are laid out for people on the commercial side as well. The main thing that you really need to realize is that there's a lot of costs associated with pharma companies doing business with everybody else within their supply chain, as well as with partners that they're working with to run their business as well.
So like the service providers to pharma companies.
Yeah.
So I think it's safe to say, man, and you're a little bit more diplomatic than I am, it seems like pharma is a big problem. It's costing Americans a lot of money.
Exactly.
All right, so let's move on. So how can we use blockchain technology to improve healthcare and lower costs?
So the reason we're also doing this with Open Health Exchange is to make these companies be able to do their job a lot easier, faster, and then obviously to drive downward costs as well, right? So some of what we're doing obviously is to lower the cost of healthcare. But the way you do that is also by making sure patients are getting remunerated directly from pharma companies as well. So it's not necessarily like one person, it's just the whole cogs in the system are not working well together.
Brian, I know you worked on the pharma side, and listen, I feel that big pharma, with their powerful lobbyists in DC, moving laws and regulation in their favor and making it impossible for competition. And I realize I may be oversimplifying it a bit, but that to me seems like the biggest problem. Do you agree?
So I've been on the pharma side, right? When I was on the pharma side, the goal really is, you're trying to make sure you cover costs. There's a lot of different things that you're looking at. There are issues when people unethically do certain things or overprice certain medications. But I would say the goal is really to produce these drugs, right? So I think, if they're not doing what they're doing, we're not going to get medications out, et cetera, right? I think there needs to be some kind of regulation. I think it needs to be easier for them to do their job. But I think there's definitely opportunities for improvement. I know there's a lot of bashing on drug companies, all this other stuff. I think the prices could be significantly decreased. I think there's a lot of costs that they're trying to absorb as well and making it lucrative to some level. That's how I'm looking at it, to be honest.
Okay, and when you say there could be some type of regulation, I almost feel like it's getting rid of regulations, making more, letting free markets solve the problems. It seems like there's too many regulations. It takes too much time to develop drugs compared to Europe and other countries.
I would say that there's regulations on some sides and not on others. So in terms of free markets and I think getting drugs to market faster could be very valuable for us all as patients. But when you're looking at free markets from a perspective of price control, et cetera, to the point of, is pharma evil? The question is, if they're self-regulating prices as well, there's going to be an issue. If you look at the Martin Shkreli thing that we were talking about earlier, they went from a drug that's priced at like $1.50, and they overpriced it to like $30. This is a drug that's been on the market for a while. Life-saving medications. And, some of those things are hurtful, obviously, to the end user. And those are things that needs to be stopped and regulated.
Gotcha. Okay, so it would be naive to say that blockchain can solve everything. I think there's some big regulatory issues and lobbying and things going on. But where could blockchain add value and, I'll say disrupt the healthcare industry?
Yeah, I think the opportunity with blockchain is tremendous in terms of a lot of downstream effects as well across the whole healthcare ecosystem. So a few things that we talked about so far really are obviously cost to end consumers, what is driving some of those costs in terms of medical innovation and research and development on the pharma side. Where we see from a blockchain perspective is bringing a lot of that control back to the patient themselves, right?
Okay, but how? How's that done?
Exactly. So for a individual, if they wanted access to their specific medical records, in the US, there's something called HIPAA. It is meant to be portable and meant to be transferable between different healthcare providers, while at the same time ensuring that your privacy is intact. So with blockchain itself, you actually can now start controlling your data and your private information and share it with different individuals that you feel like actually need access to your records. So from a treatment perspective, if you have a specific rare disease, you might need to see let's just say you have like prostate cancer. You might need to see a urologist. You might need to see an oncologist. You might need to see a radiologist. So you might need to see multiple people. And how do you share that data equally across all those individuals and making it easily accessible? And that also reduces care. Otherwise, each of these different individuals will be running the same test, potentially not coordinating care for you as an individual.
Gotcha. Okay. So this is where the blockchain comes in. You have this distributed ledger of all your health information, everything that's happened to you. So that way you take one blood test with the first doctor. The third doctor that you go to can see that you already had that test. So they have access to all this information. So It's a way to empower easy access between.
It's empowering your core team of caretakers, right? As well as your core team of physicians and healthcare providers.
Gotcha. So all this information, people can work together, make better and faster decisions. You don't need the ridiculous, I need hospital A to fax to the insurance company and then fax to Dr. C and sending letters in the physical mail or faxes. All this can be done just accessing the blockchain.
Exactly. So obviously there's that level of the blockchain, obviously being a distributed ledger. All this information is readily available to different folks. Concerns there obviously are with privacy. How do you make sure this is private? And the information is not necessarily on a public ledger in terms of my health information, your health information. So you need to make sure that it is private and that myself as an individual, I have a private key and I can share that with different folks like healthcare providers or insurance companies who need to see that information.
Gotcha. So there's also a protection side in the sense that, are you saying that the individual will have control and will be able to say which hospitals, which insurance companies can see my info and what info they can see?
Exactly. So you want to be able to control who sees what about yourself.
Gotcha. Okay.
So that's on one side, obviously from a distributed ledger perspective. But the other side of it, actually, there's ways that you also can make it very interesting, right? Because there's a lot you can do with blockchain itself. So you actually can have, when you, today, if you are getting, we talked about if you're getting a blood test done today, that data is sort of sitting some random place in some random server or on paper, even in certain places, at a doctor's office. That's not necessarily shareable with everybody. There's actually a lot of value that another provider can have by accessing that data, and they actually need it to take care of you. And we talked about even insurance companies, there are ways that they are paying for certain coverage as well for individuals, and this cost is always rising. But what if you can now say, okay, if I shared specific types of data, can you subsidize cost of my healthcare, right? Things that you know that you need to share, you would want to share with your providers. And it's even if you can make it privately shared, can you now incentivize different folks to get paid for what they're providing?
Give me a tangible example of that. That's very interesting.
Exactly. So in a situation, let's just say you had blood tests done, right? So if you are a patient with cancer, you are getting blood tests done very frequently.
Sure.
They are doing the blood test to ensure that you as a patient, that the treatment is working at the same time, that they're making sure that it is efficacious, at the same time monitoring adverse events that could be happening to you. But that blood test information is very valuable for somebody in this value chain. For you, obviously, you want to make sure you're safe and healthy and the treatment is working. But from a company who is making cancer diagnostics or a company who is making cancer medication, they actually would love to have this type of information because they are actually paying a lot of money to access this today. So, today to get that, there's many intermediaries in between. So if you can get connected directly to a company who actually would find value in this information, they'll say, you know what, I actually would love to have that information. I don't need anything specific to you, but I just want some generic information and the blood results that you got.
Gotcha.
So I just want to know this is a cancer patient and this is their blood results. And I would actually pay you for the results, or you know what, I'll make it completely free. We see even with blockchain technology, all of these diagnostic tests, radiology tests, all these things or imaging tests, everything you're getting done today can be free because somebody actually would find value in this information.
Gotcha. So they can do research.
So now when you have $10,000 per person that you're paying for healthcare, you can significantly reduce that because people don't also have to pay out of pocket for things that, other people would also find value, because we're living in an ecosystem where things can be peer-to-peer, and also there's network effects that can be happening as well.
Gotcha. So this is really interesting. I like that. So the whole idea of peer-to-peer is interesting. There's all these layers. There's research, data, and being able to make decisions, sharing information between other people, making decisions about your health, all of your records. But peer-to-peer and getting treatment and services, just enabling peer-to-peer, blockchain is the way to do that.
Exactly.
Okay. Cool. Well, that's very interesting. So now tell us, you have a blockchain startup called the Open Health Exchange.
Yep.
What is the Open Health Exchange?
Yeah, so the Open Health Exchange is a healthcare marketplace for digital assets to be shared. So what that means is essentially the idea we just talked about is myself as an individual. One, it's empowering myself to control my own data. Two, it's allowing for me as an individual to share my specific data with people that I want to share it with. So if I wanted to share this with my healthcare provider, my doctor, my primary care physician, I can share that information. But two, if I'm being told that I can actually now make or generate revenue for data that I'm shared privately and securely, and I actually can generate some revenue. So if I can make $100 for every time somebody accesses my data, that's a new revenue source for me. Or it would actually be able to, I have a high deductible health plan myself, so I would actually be able to reduce costs of care every time I see a healthcare provider.
Okay, now let me ask you a question. So you have like the patients, the individuals with their data on there, and then you give access on the other side to
whoever would consume the data.
Yeah, service providers, anyone that needs this data, and then also connecting like hospital networks with this data as well, right?
Yep.
But how do you convince these institutions to join and put all their data on the Open Health Exchange?
Yeah, so we're not necessarily specifically storing the data. What we're looking to do is, because obviously for healthcare data itself, the file sizes, et cetera, can be very heavy. You don't necessarily want to store them in the blockchain. What you want to do is with smart contracts,
right?
Key benefit is with smart contracts and connecting, like I said, peer-to-peer, but connecting patients or individuals with data consumers or service providers. So I would be authorizing specifically myself, I would be entering a smart contract as an individual myself with the local hospital here, UCSF. So I am allowing them to access specific data points that I am willing to share with them. And every time they're accessing this data, they would be paying me for access.
Gotcha. So the smart contract is Ryan's data. Let's just say, Ryan's kidney data, right? So that's stored. A blockchain will use to access the information that will automatically send a payment from UCSF to Ryan every time they access that data.
So today, if you're using any type of provider, if I'm looking at if I get like a DNA test done, once that happens, I don't know where that data goes, right? So some of these providers, they're taking my data and then they're reselling it many times over. So they're generating all this revenue. And this is the key thing, is that there's so much value in this data that these companies are just reselling your own data. I have no clue where that data is going. I'm technically agreeing to it by terms and conditions to access the service, but I have no clue where my data is going once a service provider has it, right?
Okay, now these service providers, how are you going to incentivize them to use your exchange if they're already making a ton of money from this?
There's two parts of it. So when you're looking at service providers, everybody has a small set of their own data. So a DNA company, like a genomic company, they have their genomic data. Once you have your genome data, that's it. What you need is other phenotypic data, so things that are changing. We as humans are always changing, so we need real-time longitudinal data points. And everybody has parts of the puzzle. It's about how do you bring it all together and centralize it around an individual who has access to all of their data. But if everybody has parts of the puzzle, they're not going to be able to solve it. We have great AI technologies today, but the issue with AI and machine learning, all this stuff for healthcare, is that it's the type of data you put in. Garbage in, garbage out, right? Is very commonly said. So if you don't have the right types of data or all the right data sets, do you have my proteomic data? So any of the blood tests you normally do, my genomic data.
Right.
So if you do like a 23andMe, if you have like a, microbiome or physiome data. So what about my wearables, like my Fitbit, right? All of these data sets today they're all siloed in different sectors, but how do you bring them all together, centered around an individual? So that's how you get service providers to find added value in terms of what the OHX network would have.
Gotcha. But so I'm saying from a business perspective, right? Like a practical perspective, you need to first get users to want to put their data on the open health exchange. Then when you have a critical mass of consumers, users, people, then it will become interesting to service providers.
Yeah. So we actually will be focusing on service providers first. They're already providing a value-added services to individuals and patients into the community, right? So if I'm using like Fitbit data, I'm already tracking that. Or if you're working with like 23andMe, like you're already providing that data to these companies. But now if you're working with these service providers directly first and bringing them on the platform, then it makes it a lot easier for individuals to start sharing that data through like APIs.
Gotcha. So you need to get buy-in from the service providers to join OHX.
Exactly. And we've already built a lot of those great relationships with different companies who are providing like diagnostic information as an example.
Very cool, man. Well, listen, Ryan, thanks so much for coming on the show. This is a cool format, doing the interview style. Next week, we'll be covering wine, so quite a big change. Listeners, as always, subscribe, share on iTunes, leave a review. I hope you like this. And again, Ryan, thanks so much for sharing this pretty opaque world of healthcare to the listeners of Blockchain 2025.
Yeah, thanks. Hopefully that was okay. Provide some insights to your network.
Thanks for listening to the Bitcoin.com podcast network. To learn more about our shows, visit Bitcoin.com/podcast. Bitcoin.com podcast network.